I did high school in Canada, in Mississauga. After high school, I went into university, University of Toronto. I completed my degree in bioinformatics, which is computational biology, so it's a mix of computer science, mathematics, statistics, and then biology, chemistry, and physics. After that, I went into medical school called Medical University of the Americas. I went there, I did my clinical rotations in New York, in Chicago, and actually Houma, Louisiana as well. And then after that, I got into residency at Detroit Medical Center at Wayne State University, which I concluded in internal medicine. Internal medicine is generally, as my sister says, anything that's non-surgical related. So if they don't need surgery, I'm taking care of them in the sense that it's pretty much from head to toe. I treat patients as a total package, as a total person, not just their medical ailments, but in general. I ask them how they're doing, what's going on in terms of high blood pressure, in terms of diabetes, in terms of cholesterol, in terms of all the total package I treat. And I kind of formulate a plan with them, as opposed to me just being like, hey, check your blood pressure every day. No, let's figure out, okay, I need you to check your blood pressure then. I need you to do this, and let's figure out a way to go forward with it rather than just me telling them and then going forward. So that's, in my practice, what I like to do is communicate. I like to have an open communication, and that's always important. I like cardiology in the sense that I like explaining to my patients how the physiology and anatomy works of the heart, and we have there's a lot of prevalence of coronary artery disease, and education is one way of kind of helping them and being preventative. So preventative medicine would be my answer. I do like to focus on preventative care, as in tackle the problem now rather than getting worse. If it gets worse, then you're kind of a little too late. So be preventative. That's what I like to educate my patients on. Why I chose to be a traditional internal medicine is because I can follow patients. There's continuity of care. For example, let's say, God forbid, they get admitted to the hospital. They're not going to see a random physician. They'll be seeing me. I like to have somebody from my group that's familiar with them. So I like to have control over my patients in the sense that where I know A to Z and they have a familiar face, we have a rapport. As long as we build that rapport and we move forward, and then I can know their history, and it's just, the continuity of care is very important. And from being a traditionalist, I can take care of them in the clinic. And like I said, if they were admitted to the hospital, I'll be available at that point as well. The main philosophy I have with my patients is I want them to have this open communication. Just because I'm a physician doesn't mean they can't talk to me like an average Joe. I just want to get to know them. Like, hey, Bob, how are you? How's your family? How's your grandma doing? How are your kids doing? Did he win his baseball game? I like to have... It's just not that, it's not a dichotomy. It's not a relationship just between a physician and patient. It's just a people relationship. We're humans. I'd like to know my patients on a humanistic level, and I like to treat them in that level, that we work together as a team for this treatment to benefit you. It's not just like, hey, I'm going to write you this medication, you just go take it. No, let's figure it out. Let's figure out a plan that best suits you. And I want my patients to know I will always be there. I'm always available. I like to have this open communication, and my doors will never be closed, because it's very important that they're entrusting somebody they don't know their whole life. They're telling me secrets or information about their health that, it's not privy to anybody else, and it's to me. And I take great responsibility with that. That as a position I'm in, I'm very responsible, and I like to take care of patients as if they're my own family members. I chose Willis-Knighton because of the history Willis-Knighton has, the people, the staff, the support system we have, the patient population we serve, and just the advancements they have in healthcare is just phenomenal. And the environment it gives to patients and physicians, that we have the autonomy to have that physician-patient relationship without any barriers. So that's been very important, and it's allowed me to excel in my practice and build a better relationship with my patients.